Dr. Stone is a movement disorders neurologist currently practicing. Um, okay, I feel like now this is old because I'm told she's at Vandy and I have her at Baylor Scott and White Health in Round Rock, Texas. She received her bachelor's degree from Vanderbilt University and her doctor of medicine degree from Meharry Medical College. Dr. Stone completed her residency at the Hospital of the University of Pennsylvania and was a movement disorders fellow at the NYU School of Medicine. Thanks for joining us today, Dr. Stone.
Thank you so much for having me. And yes, I am at Vanderbilt now. I joined faculty July of 2021, so it's been a couple years now. So it is a pleasure to talk with you all. And today, the conversation, as you see, you don't have slides to look at. It's just going to be me, and we're going to answer all the questions as well. And it's really about integrative medicine in Parkinson's disease and what that means. So, when you think about holistic care, also known as integrative medicine, it's kind of this comprehensive approach to addressing the well-being of individuals that we see with Parkinson's disease. So that's their physical well-being, but also their mental and their emotional and their spiritual well-being, because you're a whole person, and where one thing ends, the other begins, and it's really hard to parse out where those divisions are, and they impact your health, and they also impact your quality of life. So when I think about how we think of an integrative approach to medicine, it's really a clinical approach that focuses on treating the whole person with evidence-based practices. So not just, thinking about Parkinson's disease in isolation, but the whole person who also might have other health issues, who might have psychosocial things going on. So maybe you recently lost a spouse, or you've recently retired, or you have adult children that have issues in their families that are going on, and those are stressors for you, or you've recently downsized. Like, all of these things are important when I'm talking to people living with Parkinson's. And so it's using the whole person situation and using that in focus to how to treat someone. In addition, use complementary therapies that are not just writing a prescription on a pad or sending you to physical therapy or occupational therapy, but other complementary therapies, things such as acupuncture, and we'll get into other kind of things I'll talk about that are helpful in combination with standard therapies. So traditional Western medicine are the things that you are familiar with. You go to the doctor, they write you a prescription, you have to go to the pharmacy to get your medicine filled. Or we send you to physical therapy or occupational therapy or speech therapy. Or better yet, we send you to a counselor or to a social worker to do psychotherapy or to a psychologist. These are the things that we're all very familiar with as a part of the kind of medical industrial complex. But there are lots of other worlds that contribute to medicine and to wellness. And so we'll kind of break them up into categories. So in the complementary medical therapies, exercise and movement is incredibly important. We know it's very important in Parkinson's disease. We know that moving is medicine, actually. And I always tell my patients that your oral medications are really there to make it easier to do the true exercise or the true medicine, which is exercise and movement. And so there have been lots of clinical trials and studies about what sort of exercise people should do and how often they should be exercising. So often, of course, we send people to physical therapy first to kind of, maybe if they're not super active, get them the establishment of the lay of the land of what they should be doing. But in addition to this, there are people who are already really active, or they like other sorts of activities. And so exercises such as boxing, depending on where you might live, you might have heard of something called Rocksteady boxing, or there might be other hybrid approaches to this that you're familiar with, that are boxing classes that are focused on patients living with Parkinson's disease. And they focus on things like core strength and balance and coordination and strengthening. There's dance. So I practiced in Texas for 6 years before moving back to Nashville. And so, the land of like two-step and line dancing and partner dancing, and then also salsa and merengue and any sort of dance that gets people moving. Zumba is something you might have heard of. This is great. Also, there's that social aspect to it where you're not even really thinking about the fact that you're burning calories, you're just having fun. And it requires anticipating what someone else is doing on their feet. You aren't so in your head about what steps you're making once it becomes a bit of a rhythm and a pattern. So that's really wonderful movement to do. There's Pilates, or the Alexander technique, which so Joseph Pilates, who was the founder of the Pilates method, actually started in, I think, around, was it one of the World War one or two? I don't recall now which one. I think it might have been one, where his main focus is strengthening the core, which is really important in Parkinson's. Getting up and out of a chair, rolling over in bed, getting out of your car, bending over, picking something up. And so Pilates and Alexander technique use these kind of small micro movements to strengthen your core, to think of your whole body as one contiguous, kind of rod that's moving through space, and of being able to use your arms and legs as an extension of that. And it's really great for strengthening and for balance work. In the Eastern land, there's Tai Chi and Qigong, which are a part of kind of the Chinese medicine tradition, wonderful for balance and movement. And then yoga, which a lot of times now, some of these have even kind of been, I think, taken in bits and pieces and created into different exercise programs that physical therapists even kind of do for their own patients in therapy when they give you exercise regimens, which is great. So doing your physical therapy is awesome, but getting active in something you enjoy, also really important. And for people who like to have a certain number in their head, we often tell people that 150 minutes a week, however you split it up that's reasonable for you, is a good way to kind of get what you should be doing in your weekly time as you can. No judgment. Start where you are. Add 5 to 10 minutes every week. You also want to try to get outside, because I don't know if you all have seen, it's beautiful out there today. The sun is shining and there's a breeze and it's not too hot. So also the healing aspects of being out in nature, seeing the beauty of nature, the sun on your face, these are all things that are all a part of your well-being. There also is a realm of things called manual practices. So many of us, particularly those of us who maybe live alone, do not get as much physical touch as we ought to. And there have been lots of different studies and talks about how everyone needs 8 hugs a day, which I am definitely in a deficit of. But if you can't get 8 hugs, something that could be very, very helpful and informative kind of to your general health as well is a massage, acupuncture or acupressure, which is a part of Chinese medicine. And the philosophy is that we have this kind of vital energy that's in our body, and that there are these pathways that it runs through. And that when we have stiffness of muscle, pain, that's because that energy gets stuck in various places. And so by the application of very tiny needles in these areas along these pathways, it can help to release that energy so it can go where it needs to go. And that can help things like chronic pain and fatigue, constipation, a host of symptoms that people can have for many reasons, and that many people with Parkinson's might live with. There's also something called tapping, which has kind of gotten more and more popular in the more recent past. It's this idea that these acupressure points throughout the body can be, stimulated by you, like in the middle of the forehead or on the side of the hand near the wrist, to help manage things like anxiety, or even to help boost mood or to help treat nausea. I could really nerd out on this for a long time, but that's not what this talk is about. But that's just one more therapy that has been shown to be helpful for some of these nonspecific symptoms. For massage, it can be hard from a kind of financial aspect as to, for some people, it might be covered by their insurance if maybe a physical therapist performs it. For other people, paying out of pocket for massage can be hard to do. So if that is a barrier to entry, even if you can get one of those, massage kind of wands, or a massage that you could, bucket that you can put your feet in that massages your feet, or that you can put on the back of your chair when you're sitting down, anything like that to just help to relax muscle can really help with the muscle stiffness and muscle spasms that a lot of patients with Parkinson's have. Then there is the idea about mindfulness, being present. I think many of us are running around all day with multiple things that we have to get done. And our mind is fragmented on what needs to be done, what we're trying to do, what we didn't do fully before, behind us. And there is something to be said about the idea of taking a moment to be present where you are. And that can be as simple as just pausing to focus on your breath. That can be taking time to be in silence, whether that's for prayer or just stillness, whether that's journaling. For some people, being in the kitchen and prepping their vegetables, or women who like to sew or knit, or people that do yard work or in the garden, just something where you are focused on on one task, not multitasking, or just taking time to be present with yourself in stillness, where a lot of times it can be hard because things start to come up that can be overwhelming. You might find that you feel really sad, or you're afraid, or you just get overwhelmed by all the things that then want to cloud your mind. But I would challenge you, and it's something I've even done for myself, to give yourself just first 5 minutes of being in absolute stillness and silence, and just try to focus on your breath. Or if you're religious, to take that time to pray and just be, and see how that starts to kind of change where you are. And then if you can expand that time from 5 to 10 minutes, from 10 to 15 minutes, we found that anxiety, even pain, depression, these things that often come up when we feel hopeless and overwhelmed, if we can start to take time to put things in perspective and just acknowledge where we are and what we actually feel, that gives us some clarity. And it also gives us the ability to then hopefully find words that we can then talk to our providers about, or our loved ones about, so that we can make moves forward to helping to manage maybe things that otherwise you weren't even aware of because you hadn't given yourself the time to address it. So that is a segue into my talk about emotional well-being. So, to be diagnosed with Parkinson's disease, which is a progressive disorder, it's overwhelming. And I know for many people, the first time they get that diagnosis, they hear it, and then they also don't hear the rest of the talk in that visit, because they're now trying to process this new reality they're walking into, and how it's going to change how they imagine their life to be, or the things that they thought they were going to be able to do, and maybe is that possible now, or is it not? The idea that we are in control is really not true. It's an illusion that we kind of have that allows us to do what we do every day. And then when a diagnosis like Parkinson's comes up, you are faced with the reality that you actually aren't in control of the future. But the key there is that now, having that knowledge, how do you learn to express your feelings about that? And then how do we learn to make each day be meaningful? And how do we make sure that the quality of life that you want to maintain or that you want to get to can be met? And that is being able to know what you want and what you value, so that you can then tell people that, so that then the things that we can do to help you get there, we can target. The things that we can't fix, we can at least express, be honest about, and move through. Because a lot of times when there's emotional stuff that's not being addressed, that actually does come out in our bodies. The same way that if you're nervous, your stomach feels a little topsy-turvy, or you might feel a little woozy, or, if you're upset, your head might start to pound and hurt a bit. I mean, your body does not know if you are facing a danger or if you've just gotten bad news. All it knows is that something has changed in its balance. And I think that understanding that helps you not diminish what you're feeling. It helps us be able to then to take those feelings and actually process them and address them in healthy ways, which then also helps our Parkinson's symptoms, because we know Parkinson's disease is worse. The symptoms are worse when there's stressors that are not being addressed. I tell people that creative pursuits are a really great way to get you out of your head and connect you to other people, connect you to things that you've loved. And the idea of play as medicine is huge. And so if you're a singer, or if you like dancing, which we talked about already, or if you like drama and theater, or if you love painting or taking pictures or making beautiful things with wood or ceramics, anything that you enjoy that is creative, you should totally lean into that. And it doesn't have to be, perfect. If you're someone who's always loved to do stuff with their hands, or always loved to sing, and then you feel like your Parkinson's has made that not as good as it used to be. If it gives you joy, you want to keep doing it, because it's the doing it that is so important. It's not whether it's perfect or not. Nutrition and diets. This is a big question. Patients always ask me, what should I be eating? What should I not be eating? And I have just kind of a few cardinal rules that I tell everyone. So, we should all avoid the fad diets because one, they're not sustainable. What you're going for is lifestyle changes that are reasonable, that you can implement for the rest of your life. And so what that really means is you want to eat whole foods, which means, whole fruits and vegetables, whole grains, dairy is fine. If you eat meat, you want to know where your meat comes from. You want to make sure that, of course, when you do cook your meat, that you're maybe going more for the bake and the broil and less for the fried. You want to drink lots of water. Water is always your friend. You want to minimize your processed foods. So I often tell people that you want to shop the perimeter of your grocery store because that's where the whole and real food is, okay? If you live in a place where you can benefit from a farmer's market, or if you happen to have a green thumb and you grow your own produce, that's awesome. Totally start there. We could all be better about knowing who's in our backyard that is growing things that we can eat. And if you can do that, by all means do so. If you have access to a nutritionist, a great place to start. I've done this for some patients where I've had them give me a week of what they eat and drink with all their meals. And then I go through it and we tag team and figure out where we can start to make some changes that are not overwhelming. Another thing I tell people is you want to limit your sugar intake. And by sugar, I really mean kind of simple sugars. So, that's why processed foods, minimizing those are important because a lot of them have high fructose corn syrup or sugars in them that you don't even really realize. And like, why is there sugar in ketchup? This sort of thing. Another good place to start is drinking more water or unsweetened beverages than sodas and juices. You want to eat your fruit. You don't want to necessarily drink it if you can get away with it. And if you actually are drinking tea or coffee, if you can get to where you are having less sugar in it, it's probably not a bad idea. I clearly am not being paid by the soda lobby because I would tell you there's something we all could do. It would be cutting out soda. So there's like not any redeeming factor to soda with the exception of maybe ginger ale if you have a little, like kind of unsettled stomach. But water is going to be your friend for sure. Water, green tea in particular. And then also herbs. So there are lots of herbs that are very beneficial for all sorts of dietary issues. So a lot of people with Parkinson's have indigestion or bloating or constipation, or some people have nausea. And there are basic kitchen herbs that can be really helpful that you can incorporate into your cooking that can help with that. So ginger is an example of that. Peppermint, if you don't have acid reflux, peppermint is really great. If you do, it's not so beneficial. Any sort of herb that if you were to rub your hands on the leaves, you could smell the oil on your hands. So that's, rosemary, thyme, oregano, sage, lemon balm. Any of those herbs are really wonderful things to add to. You could, sprinkle them on your fruit or in a salad. If you're eating a salad, you can use them to marinate your meats or cook with your vegetables when you're roasting your vegetables. And a lot of these are really great for settling your stomach and helping with digestion, since digestion can be a bit slower when you have Parkinson's disease. And that actually is a perfect segue into kind of the herbal medicine land, which a lot of people ask a lot of questions about, how should they take herbs? When should they not take herbs? I always tell people you're never going to go wrong first by incorporating them into your diet, because if you're eating them and using them as, as food, odds are you're not going to overdo it. Whereas if you're taking them in capsule form or tablet form, it can sometimes be a bit more intense depending on what it is you're taking. I'll give you some examples about that. So some of the ways that I tell people to introduce them into their daily life is tea, something as simple as just like a ginger tea and a little bit of honey, or if you can't sleep at night, a little bit of lavender tea, or there's a brand, Celestial Seasonings. They have Sleepy Time tea, which has, I think, chamomile, and maybe passion flower and lavender, and I think maybe lemon balm in it, which are all very gentle herbs that are very, very helpful in kind of relaxing the mind, relaxing the body, making it easier for people to fall asleep at night. For people with muscle spasms, muscle pain, or even joint pain, having like either oils that are infused with herbal remedies like arnica or skullcap. I'm trying to think of another off the top of my head. Well, even CBD. Those can be in salves and in topical oils that you can rub over the places that are sore. And you can put heating compress on top of that so it can really absorb, and that can be very helpful for localized pain. If you're congested, steams are great. So, you boil some hot water, you take a few essential oil, if you have an essential oil, or if you have, a plant like a eucalyptus. If you live near a Trader Joe's, they have eucalyptus that's, fresh on a stalk. You can hang in your shower, and the steam from the shower kind of starts to activate the oils in the eucalyptus, and you get this beautiful steamy eucalyptus shower situation. And you can get the same thing with herbs like lavender and peppermint or tea tree oil that you can just kind of breathe in and breathe out, which is really great if you have congestion from allergies or a cold or things like that. And it's way less invasive, and you're probably not going to get the same side effects you'd get if you take something over the counter if it's not a significant health issue. So supplements are another thing people ask me a lot about. And, I kind of have this divide. There is the botanicals, which are, your naturally occurring plants and roots and things that grow. And then supplements are things that often our body has already in them. And then we want to support our body because maybe we don't get enough of it because of, I don't know, not being out in the sun, if you're talking about vitamin D, or not eating enough. Maybe you don't eat meat or you can't do dairy. So you're not getting enough vitamin D or calcium, things like this. So people often ask me what sort of supplements they should take. The first thing I tell people is that less is more, and it's really easy to have a bag full of supplements, which is really not any different than having a bag full of pharmaceutical drugs that someone's prescribed for you. And the difference is that really no one's really directed you in what to do and who, what brand to buy supplements wise, what sort of supplement to be taking. And so it can be very overwhelming, and you can kind of be grasping in the dark at what you should be doing. There are a few things that are often just low for the general person in the modern world, which they probably won't do bad in taking. So magnesium is one of those, and just, like 300 or something milligrams a day. People have muscle cramps, muscle spasms, really helpful for that. If you have kidney disease or an active bladder infection, or if you have a neuromuscular condition called myasthenia gravis, you want to talk to your doctor before you take magnesium, okay? Particularly your kidney doctor or your primary care doctor. Folic acid is something that women are very familiar with because, of course, it's part of the prenatal vitamin. A B complex vitamin is often helpful. As we get older, sometimes our B12 can kind of fluctuate a bit. And actually, if you're on carbidopa, levodopa, that competes with B6 or pyridoxine. And so sometimes people might have low B6 levels when they're on higher doses of levodopa. And so if you've ever noticed that you get a numbness or tingling that's in your hands or in your feet, you want to let your doctor know so you can check your B6, because if that's low, it's a very easy thing to supplement. However, if your B6 is normal, you don't want to take too much because you can be toxic on it. And that can also make your levodopa not as effective if you're on too high of a dose of B6, just so you know. Also, iron is something that people often take because there's anemia, which is very common, or iron deficiency, which can make restless legs worse, which can contribute to fatigue. If you're taking an iron, either on its own or in a multivitamin, you just want to make sure you take it separately from when you take your levodopa dose, just because it kind of makes the two compete with each other for absorption. So you just don't want to have them taken together. But if you take your iron like first thing in the morning and you take your levodopa an hour or two later, that's fine. As for other supplements like coenzyme Q10, glucosamine, I'm trying to think of anything else people have asked me about. Those are probably the two people ask me about a lot. They did some clinical trials with high dose coenzyme Q10, high dose glucosamine, didn't really see, or glutamine, didn't see much benefit uh, in Parkinson's disease with high doses of these supplements. So it's not that these are going to be helpful for Parkinson's per se. If you're taking them for general antioxidant benefit and, well-being, that's fine. I also tell people make sure that you use a reputable brand for your supplements because they're not all created equal. And I would not encourage you to get your supplements from Amazon because you don't know how long those things have been in the warehouse, if the warehouse was cold or hot, and how that impacts, compounds that are sitting in a warehouse for who knows how long. So if you can go to an actual pharmacy, like, a GNC or a Whole Body, or talk to someone at a health food store, or have the brand that has a website, that's the way to get your supplements. Mushrooms. So medical mushrooms are really getting popular these days, and I don't know how much you've heard about them, but there are a host of different types, and there are a couple that are actually edible and that you've probably heard of in different cuisines. So shiitake and maitake, often used in Asian cuisines. They are notorious for being very helpful with kind of anti-inflammatory effects. Shiitake, surprisingly, has high vitamin D, and it also can help in decreasing your blood cholesterol, which is awesome for those of us who might have elevated cholesterol levels. And you can, we're in the fall weather heading into winter, so you can make broths from these things. You can find them dried in your store and reconstitute them, or if you find them fresh, you can make a stir fry out of them. You can powder them down for people who don't like the taste of mushrooms, and then you can add that mushroom powder to other things so that you don't necessarily have to taste them. There also are some medical usage mushrooms that are really not edible as much as they can be made into tinctures, or they might come in a capsule form. And a couple that are kind of note in Parkinson's. Lion's mane, which actually is also edible, looks like a puffy white ball, and it looks like hair. It's real fluffy. It actually, when cooked, has the texture of a shellfish, like crab or lobster, and it has been used for thousands of years in Chinese medicine for being neurosupportive. So if you happen to be at your farmer's market or at your grocery store and you happen upon lion's mane, totally add that into your diet. If you want to take it in tincture form, you could. About 3 grams a day in tincture form can be helpful, which is probably like 2 dropperfuls. And actually, I've had patients who I've told about this, and they've taken it, and they have found it to be very helpful with their cognition. They feel like they're a little bit brighter, that they aren't as fuzzy sometimes, and brain fog can be a very hard, nonspecific symptom to help. And that's something that for some people has been beneficial. For people who struggle with fatigue, there's a mushroom called cordyceps, which has been known to be helpful with fatigue as well, and giving a little extra boost. You could also find that in a tincture form, or sometimes in a capsule form. There's a brand called Host Defense. I own no stock in this. And there is a mycologist, Dr. Paul Stamets, who developed this brand of mushroom supplements. And he grows the mushrooms organically, because you always want to know where your mushrooms are being grown, because they can grow pretty much anywhere where there is decaying matter. You don't want that to be a place where the area is polluted, because then that's not good for us. So organically grown and harvested appropriately, that's the kind of thing that you want to know when you're using mushrooms for a health standpoint. So I've had people ask me, well, are there any herbs that are good for Parkinson's specifically? So there is a plant called the broad bean, or the velvet bean, which is known by its Latin name, Mucuna pruriens, and it contains about 9 to 10% of levodopa by weight. It is not standardized like carbidopa, levodopa, or Sinemet, which is really why your doctor probably doesn't write this as the thing you should take first if you present to the doctor and you're talking about starting medicines for Parkinson's. And because it's not standardized, it can be hard to know what the benefit might be for people with, a certain amount of mucuna. What often happens is the product might not be the same every time, or depending on whether you're taking it 3 capsules or 4 capsules, that could change the potency of the levodopa amount. And because there's no carbidopa associated with it, some of the symptoms people might notice with it are nausea, which is something that can often happen if you have high doses of levodopa, and not as much carbidopa to buffer that. There's also medical marijuana, which I get lots of questions about, and cannabis, which is, of course, the plant family that marijuana is in. Marijuana and hemp, they're pretty much the same plant. The difference is how much THC, which is the psychoactive compound in marijuana, how much of that is present determines whether you're dealing with hemp versus cannabis, hemp versus marijuana. So THC, which is very much, not legal everywhere. In some places legal for medical use, in some places not. But I think pretty much everywhere you can use hemp and hemp derivatives, which CBD is that. And I think you've probably heard of Delta-8 if you've ever done any research, and that's the psychoactive compound that's in hemp. Those are purified chemicals that we think about that can be isolated from cannabis. So, like anything else, there is not one size that fits all. There's not one sort of supplement or botanical or medicine that works for everybody to the same degree. But for some people, they have found that if their tremor comes from anxiety, since CBD has this kind of anti-anxiety effect, relaxation effect, it can help their tremor. Or they might sleep more easily because of it. Or because it's an antispasmodic and it releases muscle, which we talked about, applying CBD salve or oil, rubbing it on an area that's sore. Well, in the same way, if you have lots of muscle rigidity, muscle spasms, or cramps, then using CBD could be helpful. THC is the component in marijuana that has been used a lot in nausea. So people who don't have good appetites are prone to nausea, very popularly in the land of cancer with people who had chemo-associated nausea. We know THC can boost appetite and could also quell the nausea that people often had from their chemotherapies. And so it had a benefit and a role in that way. And so I think of places where it can be helpful is in weight loss associated with Parkinson's, stiffness, trouble with sleeping, dystonia or muscle cramps and pain. And then maybe if anxiety is an issue, the tremor and the dyskinesia that gets worse because of that. Of course, for some people, marijuana can make some people more anxious. So that's something that we always kind of keep an eye out for. But, if that's not the case, then it's something that it could be considered for some of those symptoms. But just for Parkinson's itself, the slowness of movement, the tremor just in and of itself, it does not help those symptoms. In addition, besides the fact that it can cause some anxiety in some people, for other people, it can make them less steady on their feet. It can cause psychosis or hallucinations for some people. They can get paranoid. It might cause some people to have more apathy than they didn't have before. And for other people, it can also make them confused. So there are some limited clinical trials. They're doing a lot of research on this in places like Canada, where they have just made it legal across the board for the use of marijuana, both recreationally and medicinally. And hopefully we'll have more data and more information in the upcoming years about this as we remove the stigma on this compound so that we can get more information about how this can be helpful for people living with Parkinson's disease. And I know the Parkinson's community is very busy in advocating to ease some of the federal restrictions on this research so that it can be done and we can get this information. Because at the end of the day, the goal is, how do we improve quality of life? And how do we extend the improvement of quality of life for as long as possible in our patients that are living with Parkinson's disease? And I think in large part, when I think about integrative medicine and why I feel so strongly about it, is that I want to make sure that I'm using every tool that is in the arsenal that we have to make sure that our patients are getting any sort of benefit they can with a low amount of risk. And that we want to make sure that we know that we're on the same side. If you find out something, like I'm going to go, well, I haven't heard of that. Let me go look that up and let me see if someone else has used it. And if it does, I add it to the list of things that I can offer to other patients in the future, because knowledge is power for all of us. And, until we find a cure, we find something that really slows down progression, what we can do right now is at least be able to increase our symptomatic treatments as much as possible. So I do not want to take up more time so that we have questions, because I'm sure there are questions. Thank you.
This was incredible. Before I ask questions, somebody did ask that they love your holistic options. And I'm not going to lie, I'm kind of in love with you right now because I'm loving your empathy. Do you see patients via telephone or Zoom?
I see people, well, not via Zoom anymore because they have stopped that at Vandy. But if you're in the state of Tennessee, I see patients via telemed. We don't typically do new patients via telemed with movement disorders, so we can kind of get a baseline evaluation. But then from that point on, I will see people telemed if they're in the state of Tennessee, just because of licensing. Before in COVID, we could see people everywhere, and then they kind of said, oh, well, you have to have a license to see people across state lines. So
we did have, because you talked about sugar at first, so we have a couple of questions about that. Someone asked, is stevia in the raw okay to use?
Good question. Stevia is great. Stevia is great. And there you go, another plant. So here we are.
What about if I substitute agave syrup for sugar? Does that make a difference?
Okay. So another thing I learned this on my own just recently about this idea about glycemic index. And actually, the lowest glycemic index sweetener is maple syrup. That's an FYI. So more so than honey, more so than agave. So especially if you're someone living with Parkinson's who also has diabetes and you're trying to, be a person and enjoy sweet things, but also do right by yourself. Maple syrup and keeping an eye on your blood sugar and seeing how that responds in contrast to some of these other sweeteners is a great thing to consider. Pretty much any other sweetener, your body sees it as a sweetener. You're not doing bad by having agave as opposed to processed white sugar. And those things are fine in moderation. I think the thing to keep in mind is that when you don't make your own food, we don't bake our own bread like we used to anymore, and we maybe don't make our own canned things, we are not in control of what's being put in them, which is why my big thing was making sure that you eat whole foods, so that if you want to have a cookie, gosh darn it, you can have a cookie. But if you eat a ton of things that are in cans and boxes and in bags that you don't have any control over, you're getting all this extra sugar that you had no plan to even necessarily get, or if you're drinking it in your drinks. And then that's way more sugar than you actually need. So it's really just about figuring out where you want your sugar to be so that you can control it. And then you can use your sugar as you see fit.
Then we have a question about, you had talked a little bit about magnesium. Is there a magnesium you recommend, and can it help with sleep?
Good question. Okay, so the magnesium I take is magnesium glycinate because that one is not as active on your GI tract. If you have constipation, then milk of mag sulfate, mag citrate, great. If it's more relaxation, sleep, muscle, benefit, magnesium glycinate is a very good one to use. And I will give a plug to another brand that I own no stock in, which is Pure Essentials? Okay, now it's going to bug me. Hold that thought, because I want to make sure I give it to you correctly. Actually, I think it's coming in the mail for me today, so I can give you the real name.
And you had said 300 milligrams of the magnesium?
Yes, Pure Encapsulations. That's the brand that does magnesium glycinate. I think it comes in a 200 milligram capsule. So you could just do, it's 100 or 200 milligrams. You can do 300 to 400 milligrams a day, and that's perfect. I usually do mine in the evening.
Okay. Somebody asked me, so I am going to put how to spell it, magnesium glycinate, in the chat. Okay. I had to check Google because nobody wants me spelling.
That is it.
And then somebody, and it's interesting because I had personally never heard of lion's mane, but someone else, and you brought it up, and they said that they've heard that lion's mane and ashwagandha helps with symptoms?
Yes, also ashwagandha is used a lot in Ayurveda, so kind of like the Indian medicine, that whole India subcontinent, not Native American. And it is very helpful for relaxation. It can help with sleep, can also help with anxiety. Um, there's a brand called Traditional Medicinals that does a lot of herbal teas, and they do an ashwagandha tea. I think it might be ashwagandha and holy basil. Tulsi is the other name you might see, which I've had some patients who take that every night to just kind of unwind, and they swear by it. Or the Tulsi rose, which is like holy basil and rose, and they're like, I just feel like everything's better when I have that cup of tea before I go to bed. So that's another one that's totally helpful as well.
And then I do want to make sure somebody asked what was the doctor's name who created the company you mentioned but joked you don't own stock. Somebody wrote that was Host Defense with Paul Stamets. Is that
Yes,
correct?
that is correct. Paul Stamets. He's the mycologist, which is like a mushroom expert, and he's not a clinical doctor. He has a doctorate in, I think, botany or something like that.
While we're still talking about the magnesium glycinate, someone asked, can you take glycinate in the evening and citrate in the morning?
That is a good question. I usually tell people not to double dip the types of magnesium they take. So if you, let's say you were taking mag citrate for your gut, you could just, there are other things you could do that wouldn't require you to take mag citrate, that you could just take mag glycinate if you're doing it for muscles. So, I'd say pick one version of magnesium. Don't do both, just so you don't overdo it.
And then somebody asked, because you were talking about glucose, is there an easy way to check your own glucose level without taking blood?
There is not.
Okay, straight answer. There is not.
And I'll say, if you're not someone for whom, if you have a primary care doctor and you're doing your regular checkups, trust me, they're looking for diabetes. So if you're doing that annually at the least, and no one's told you, then you're probably just fine.
And now okay. I was gonna say, I was gonna ask some questions that I have, but people wrote in more questions. Do you have any thoughts about probiotics for gut health?
Yes. So yeah, probiotics are interesting because I have a couple friends who are GI docs, and I always pick their brain about it. And they kind of scoff at me sometimes about probiotics. And I'm like, this is what you do. So I feel like the idea of the microbiome we know is important. And we know, particularly now, we're learning about the communication between our nervous system, your brain and your spinal cord even, and your gut. And that your gut makes the majority of your serotonin, which is a neurotransmitter. So clearly there's stuff happening between these two worlds. And what we eat determines what's in our gut. So if you change your diet, your gut flora changes. And if you go to another country, like if anyone lives in the States and then they go to Mexico and they eat fruit and they don't get like ill from food poisoning, but they just kind of don't feel quite right, that's because you are being introduced to new bacteria that your gut is not familiar with. At the same time, there is something about making the gut flora as diverse as possible that is good for your health. And like the older we get, and a lot of neurodegenerative disorders and neurodevelopmental, like autism and such, are related to the fact that people's gut flora is not diverse. So I would say that you probably can't go wrong with a probiotic. I don't take one myself every day, but I will say that if I'm traveling to a place where I feel like things might get off course, I'll start taking it a week or so before while I'm there, and then a week or so after I come back home. And if you're somebody who just struggles with GI stuff, particularly constipation, it probably wouldn't be a bad idea to just start taking one, and I always tell people, let your primary care doctor know, ask them. It's also good to keep us on our toes. We get really used to being like, we have our our pitch that we do, and we do the pitch. And then patients throw us a curveball, and it's good because then if you're a good doctor, it makes you go, I should do some due diligence about this because things continue to change. We continue to learn new things. So by all means, you can't go wrong with a probiotic. You're definitely not doing any harm if you want to try one.
This is A good question, because obviously with Parkinson's you can have the dyskinesia and such, but you talked about some of the alternative therapies. If it's hard to lie still, what can you suggest to work with a massage therapist or an acupuncturist?
Mm, that is a good question. So I guess the first thing, excuse me, is if this is dyskinesia that you can't be still with, are you always dyskinetic is a question. And being able to maybe figure out a way around when you're not dyskinetic. And if you're always dyskinetic, then this is an even bigger question about the management of your symptoms and how much this movement's impacting your quality of life, right? Because the goal is that you're not so dyskinetic that you can't be still for even short periods of time while you're awake. Um, I think with massage, probably more easily than with acupuncture, because, if you're trying to place small needles, it's probably nicer to have someone be able to be still. But you can kind of work with somebody who has to move around with massage, because there's not going to be any harm there either. It's just, they're just going to have to know what you have issue with and work around it. Just communicate what that is. And I think once you do that, they can figure out how to modify.
Of course, this would not be a Parkinson's program if we didn't talk about constipation. So, do you have any herbs that you recommend for chronic constipation?
So, okay. So a few things. One, when we think about constipation, there are multiple layers to it. In Parkinson's, of course, your gut moves slower, which doesn't help. Two, you get rigidity in your abdominal muscles, which also doesn't help, and then makes it even more difficult to go. Then you're sitting on a commode, and most of us probably don't have. I don't know if anyone's heard of a squatty potty, but if you haven't, this is something you should consider. Or even if you have like those exercise blocks, something that you can put your feet up on, so that you actually can be in a proper squat position, because that actually helps gravity to allow you to not strain when you have to go. So that's first, like the body position. Okay. Then you have to stay hydrated. And so many people don't drink enough fluids because they have to urinate so frequently that they're trying to, like, rob Peter to pay Paul. But all you're doing when you're urinating is it's your kidneys filtering your blood. So you might as well support your kidneys doing their job by drinking your fluids and staying hydrated. And if anything, restricting your fluid at the end of the day. So you want to drink lots of fluids. The warm liquids help more because warm things relax the gut, help things move through more easily. For some people, black coffee is sufficient. For other people, dairy helps them. You're going to also benefit from things like prunes, so dried fruits, prune juice, prunes, figs, dates, raisins, any sort of dietary fiber like that. Then you want to think about flaxseed, actually, so things that are slippery. Okra, flax or chia seeds that kind of get that kind of gelatinous texture to them when they have water. So I actually had a patient, this is actually very, very gentle, and they do this for little kids who have constipation, is that you take 2 tablespoons of flaxseed, pour boiling water over it, strain it, drink it, like let it steep for 10 minutes and then strain it, and then just drink on that water all day long. And you're not going to do it yourself any disservice by doing that. And that actually can help you get things moving more easily. Senna actually is an herb, but and there are lots of naturally occurring laxatives in the world, but they are stimulants. And you don't want to just be using stimulant laxatives on your gut if you don't need them, because it keeps your gut from doing its job. And they can sometimes be a little too violent, or you can overshoot, and that's not the goal. So glycerin suppositories, what's another thing that I tell people is really helpful? For the Miralax folks, if it's too, I tell people start with half a capful every day. And then if it's not enough, a capful every day. And if that's too much, a capful one day, half a capful another day, alternate. Because really what Miralax is doing is just pulling fluid into the gut so you can move things through. That's all it's doing. And if you have more fluids, that's also helping. So that's kind of that's my constipation, 101.
Somebody asked, because you kind of mentioned magnesium for the muscle cramps. Is there anything else you recommend that helps with muscle cramps?
Oh boy. So other things can be helpful. So there, anecdotally, pickle juice. If you can find tonic water with quinine. I tell people stretching before they go to bed can be helpful. Also, staying hydrated is huge. So any sort of electrolyte drink, they have a lot of those nice electrolyte powders for people who don't want to do Gatorade or Powerade, which are also helpful. Coconut water. These are all things that are helping get your electrolytes back in the order that they need to be in, and that can help with cramps. For topical things, I'm trying to think if there's anything else besides magnesium. Actually, in a salve or a spray, people find to be helpful for muscle cramps if they're focal as well. So those are other things that I recommend. And then CBD ointment and oil also helpful, and CBD tincture for cramps too.
Yes, about sauerkraut. Does that help at all?
Oh, so sauerkraut, I was thinking about that in the land of probiotics, which it's really, probiotics are great in fermented pickles, kimchi, sauerkraut, and any sort of fermented, yogurt, these sorts of things.
Let me ask, do you need to use a neuro?
I think we lost Eden.
Yeah.
It seemed like she dropped off real quick there. Well, we are nearly at the end of the hour anyway, so let me unspotlight you, Dr. Stone. And thank you so, so much for today's program. At the end of our live streams, we like to do the wave of gratitude. So if everybody will give Dr. Stone a wave, we'll wrap up today. And thank you so, so much.
Well, thank you for having me. I appreciate it.
Have a good day.
You too.
Bye.
Bye-bye.